The most common question I get in my clinic isn't from athletes. It's from people who walk in a little sheepish and say, I'm not really an athlete. Am I even in the right place? The answer is yes. And in the next few minutes, I want to tell you why. Hello, everyone. I'm Dr. Erin Wos. I am a sports medicine physician right here in Eugene, Oregon. And I founded WOS Performance Clinic because I wanted to build a different kind of practice, one that meets people where they actually are. Today, I want to answer the 3 questions I hear most often, starting with the one you might be asking yourself right now. So let's start with the question I get most often. What does a sports medicine doctor actually do? So sports medicine is not just for elite athletes. It's an essential field dedicated to helping anyone with a body maintain optimal function and stay active in their everyday lives. Sports medicine is a specialty within medicine that focuses on the musculoskeletal system. So your body's joints, your tendons, your ligaments, your muscles, the nerves that connect them all, and how that whole system performs when you use your body. As a physician, I'm trained to diagnose what's going on, order imaging when we need it, and perform procedures. Regenerative ones in particular, like platelet-rich plasma, which is commonly known as PRP, prolotherapy, nerve hydrodissection, and TenJet, all of which help tissues heal rather than just covering the pain. But what surprises people most is how much of my job is about listening and being curious. I'm always asking, where did this start? Why is it happening now? What is your body trying to tell us? That's how I help you heal. Now, to the question you might be asking yourself as well, do you have to be an athlete to see a sports medicine physician like myself? This is the one I want to spend the most time on because I want to redefine the word athlete for you. In the realm of sports medicine, and from my perspective, every body in motion is an athlete, deserving of specialized care tailored to their unique needs and unique goals. So I developed a passion for sports medicine through my own experiences as an athlete. I grew up running right here in Eugene, and I ran in college at the University of Arkansas. Then, after a series of many injuries, I pivoted to race walking and competed at an international level. So I understand the athlete brain, the relationship between identity and performance, the fear of being sidelined, and the urgency to get back after injuries. But here's the truth. Most of the people in my clinic don't think of themselves as athletes. They are grandparents trying to keep up with their grandkids. They are gardeners with cranky knees. They are people who used to run and have been told to stop and really miss it. They are folks rebuilding after a surgery or an injury or just life. And here's what I tell them, especially my weekend warriors, my recreational runners, my golfers, and my pickleball players who walk in feeling like they don't quite belong here. You have a body, you are moving your body, you are an athlete. That's whom sports medicine is for. And the last one I hear all the time, how is this different from physical therapy? So this comes up a lot, and I love getting to clarify it because physical therapists are some of my closest and very treasured collaborators. The simplest way to put it, a physical therapist and I do different jobs, but we are on the same team. My job as a physician is to diagnose the issue, find out what's happening, use imaging when we need it, and then offer medical interventions, including the regenerative procedures I mentioned. A physical therapist's expertise is on the rehabilitation side, so rebuilding strength, retraining movement with proper biomechanics, and getting you back to doing what you love. A lot of my patients benefit from both. I help figure out what's going on and then use the medical tools to help it heal. Your physical therapist is going to help you build it back stronger so it doesn't happen again. So 2 different but very important specialties with one goal. So if you've ever wondered whether sports medicine was for you or what regenerative medicine actually looks like in practice, I'm going to be sharing more of these conversations here. Just plain language answers to the questions I get asked every week in my clinic. If that sounds useful, please subscribe and stick around. I'd love to have you here. I'm Dr. Erin Wos, and at WOS Performance Clinic, we help you stay in the life you love.